You can start now.
Hello, my name is Dr. Memuna. I'm one of the children doctor here. May I confirm that whom I'm speaking with?
This is Halima, mother of Sarah.
Nice to meet you, Halima. So I'm here to discuss about your SARA condition. So is this suitable time for you?
Yes, doctor, I'm very much worried about Sarah. You can go ahead.
Okay, before I start, do you want anyone else to join this meeting?
No, doctor, all are busy. I am alone here. No one is there. It's okay. You can continue with me.
Yeah. Okay. So, Miss Halima, I have read your notes, and I came to know that Sarah is having some condition of the heart, and for this, jelly scan was done. Did anybody have update you about the report of the jelly scan?
No, doctor, I don't know anything about it. Is anything wrong with Sarah?
Yeah, that's why I'm here today. So, actually, as a part of her illness, she has a condition of heart before, and she developed fever and tiredness. So we have done a jelly scan, and unfortunately, we came to know that she has infection of the lining of the heart, and this is called as infective endocarditis. Have you ever heard of this before?
Oh my God, what are you telling, doctor? I haven't heard about it any time before. You mean infection of the heart?
Yes, I'm so sorry for that, but yeah, this is similar to infection of the heart, infection of the lining of the heart.
Oh, is this serious, doctor?
Well, if it is treated and diagnosed in time, so we will able to manage it. But if it is not treated, so it can be serious.
Okay, so doctor, I am feeling very bad now. Maybe this is because I did not kept my child on follow up with the doctor from long time. We are not following up. This may be the reason for this.
So, Halima, I want to reassure you that this is not your fault. And any child who having this condition of the heart, as I understand from her notes that she is having ventricular septal defect as well, so they are at risk of developing this condition. And also I came to know that she has certain tooth caries. Am I right?
Yes, yes, she has dental care, tooth caries. Yes, doctor. Uh,
Okay, so yeah.
so now, really, my child from 3 weeks, she is suffering. So what you will do for her? How can you bring her out of this situation?
This is very important because, as you know, that as a part of her treatment, already antibiotic, the medication for bug have been started from last 4 days, and this will prevent from this infection of the to going infection. And also we will monitor her. We will, as she's already admitted in the hospital, we will monitor her, and maybe we need repeat jelly scan of the heart, and we will involve the heart doctor as well.
Okay, doctor, how long you want to keep her in the hospital and give this anti-bug treatment?
Usually this antibug treatment is needed for a few weeks, but we will it will be decided according to her condition. So that it usually takes 6 to 8 weeks, but that will be according to her condition. And we will also involve other doctors, as we will involve the teeth doctor.
Hmm. So, doctor, you're telling it will take a long time, like 4 weeks or with some weeks time. So, I want to know what about her school. Can we? I am worried. How can I make her absent to the school so long?
Yes, for the school we can support her. Like I will arrange with the meeting with the school nurse and let them know about her illness, and we can arrange, like if she is able to take some online classes, or we can arrange that she can attend these miss homeworks later on.
Okay, doctor, I was thinking that you're telling that she needs antibiotics, but I am thinking that uh, we should treat this condition with surgery. Why can't we do the surgery now? And so that once for all she'll be fine.
Yeah, so Miss Halima, do you know that surgery is not cannot be done once the infection is settled, then the heart doctor will be best to tell you when the surgery will happen. This is not the right time to do the surgery. So am I clear so far?
Yes, doctor, you're uh, clear. Yeah, I was thinking that the treatment for this condition is surgery, so that if we close the hole, the child will be fine.
Yes, absolutely, you're right. And but as I mentioned you, that heart doctor will be the best doctor to tell what will be the timing of surgery, and they will definitely do it later on, but not at now because she's having infection right now.
Okay. So what else they will do with my child? How they will follow? 6 minutes, 3 minutes left. So how
Okay,
they will follow up, and what else they will do?
so they will follow up they will also give some medication to prevent some antibiotics may be needed later on in small dose, that is prophylactic preventive antibiotics. And we will also arrange the teeth doctor and heart doctor will be involved, and we will be kept in regular follow-up, and we will update you about her condition.
Okay, will this infection of the heart will go, or there is a chance that she will continue to have it throughout the life?
Yes, for this question I have to check again and come back to you if you don't mind.
Okay, doctor.
Okay, so Halima, do you have any other concern, and are you happy with the management plan what we discussed today?
Yes, but the management looks to be very long. This is what is making me worried about a few weeks, you said.
Ye-
And I don't know, and I feel it's my fault because I was not following up. This may be the reason.
Halima, I want to reassure you that we are here as a team and we are searching for the best interest of Sarah, and we will support you as much as possible. And if you have any issues, we can also look into it.
Okay.
So, Miss Halima, we today discuss a lot of information about Sarah. So I will just summarize that so that I can confirm that we are on same page.
Okay.
I talked to you about the diagnosis of infective endocarditis Sarah is having, and why she developed it, and how we will follow up her. And I also told you that we have to give her antibiotics and keep her in follow up. So I will give you certain advices that you have to keep a very good hygiene after she is discharged from the hospital, and you also have to comply to medication. And also you should look for any sign, like if she develop fever again or shortness of breath, you could come to the hospital again. Am I clear?
Yes, doctor. You're clear.
Okay,
Okay.
so I will also arrange your meeting with the
Yeah.
heart doctor.
Hmm.
And if you have any other further question, like your queries about the surgeries and any other thing, so you will they will be you can ask them more question. And I will also give you some of the leaflets and the very trusted website, so you can have a read of it. And if you have any questions, so please write down here. We can discuss it again.
Okay, doctor.
So yeah, so Halima, I want to reassure you that we are here, and if you want to talk, sit with me again, and I can arrange another meeting for you as well. And if any of the question that I was not able to answer today, I will let you know again.
Sure, doctor.
Thank you.
Thank you. So I will give you my comments to you. See, this is what happens in the exam, because why I did not give the topic before is, in the exam, this is what happens. Suddenly you will get a topic. So you should be in a condition that you should be able to, whatever topic comes, you should be able to speak at least minimum what is required for a communication. This is what I want to convey the message today. That's why usually the topic is not given before, that suddenly if you get a topic, you should be able to speak about it, at least in the layman terms, to the mother. And maybe you might need some more information if it was for the student. Okay, but for the
Yes.
mother, it should go in layman terms. What you did was okay. Only thing, sorry, it was my mistake that I did not, I had written the mother's name and child's name, but I did not tell you.
Yeah, that's right.
It was mistake. Yeah, I wrote here,
Okay.
but I did not tell you. That's why I answered you like that. But usually in the exam, you will have already the mother's name and child name. And if you fear that you will forget, please write it on the paper. Okay. No need to write much things in the paper. Only thing what you will write may be mother's name, child child's name you will write, and also any drawing you wanted to do relevant to the topic, you will do it usually in the paper what they provide to you. Okay, no need to write other things, because the reading itself will take more than 2 minutes, and concentrating on these things like what is the child's name, mother's name, we should not make mistake in it. And also if you have to draw something to convey the message to the mother, you can do it. Okay. So you, in the starting your RAPO, there was some problem because you did not know the mother's name. If you knew the mother's name, so your presentation will be like this. Like you will introduce yourself. For example, if it's me, I will say, this is Dr. Noor, one of the children's doctor in this hospital. Am I with Mrs. Halima, the mother of Sarah? This is how you will make it in one sentence. Everything, you will introduce yourself and you will ask the, confirm that you are talking to the same person. Okay. Then there are some choices. You should tell one more sentence of a RAPO, which you did not do. Like usually they say, don't say how are you, because how are you is the sentence of RAPO. But the thing is, sometimes if the role player is
I
maybe
just said, nice to meet you. Nice
not
to meet you.
not in good mood, they can answer something and the conversation may go in a wrong way. That's why they say, don't ask how are you, just say nice to meet you, or thank you for coming here, or you can say both together, nice to meet you and thank you for coming here. You said, maybe I missed or something, I don't know. Okay, one more word of RAPO is very important. Then you will tell that you ask for the attender. It is good that anyone else you want to attend. Regarding the previous knowledge, did you let the mother to tell, or you yourself said? This is my doubt.
Just I asked her that the jelly scan is done. So did anybody update you about the result
No,
of jelly
don't
scan?
ask in that way. Yeah. That is what I
Ah,
written here, question mark for previous knowledge. No, don't, that means you're giving her some question. Like, for example, now you told her, jelly scan of the, anyone updated? No, don't ask her the previous knowledge. You have received a letter that you know that certain points about the child, that child has VSD, child has dental caries, and child has ecodon and vegetation. All these information you have. But still, before delivering the information, you should, don't give her a leading question, give her a general question like, well, Mrs. Halima, or well, Halima, can you tell me what do you know about your child's present condition? Before you say anything, for all the scenarios, just make this a general question. Okay, don't tell, does your child has VSD, dental care, nothing. Just ask her, can you tell me what do you know about your child's present condition? Okay, then definitely
okay.
I think she wouldn't have been updated about the echo, which you have to update her. Definitely, she will tell about, in this scenario, the mother had told that she knows that her child has a hole in the heart. Okay. And also her child has dental caries, and she has fever from 3 weeks, fever and tired. She is refusing to do anything from 3 weeks. This much of information she will give you. That means half of the information you read from the leaflet is given to you. Now only you have to deliver to her about the echo and the diagnosis. Okay.
All right.
Don't ask her like the jelly scan was done, anything was updated. No, ask her in general, what do you know about your child's present condition? Okay. So the answer here given by the role player was she knows that she has a hole in the heart. Suppose she did not tell you about dental caries, then when you are explaining, you can tell her that I got to know from her notes that she also has caries tooth like this. If she leaves something, you can update her, no problem. Okay. And your empathy should be more. When she said in the beginning, she told that I am very much worried, doctor. You did not tell anything about for the empathy. See, in communication, they will be watching you. Whenever the role player says, I am worried, I'm feeling too much bad, it is my fault, everywhere it needs empathy. I think when I said my fault, you told something, but for when I told in the beginning I'm worried, you did not tell anything. So you should have some different ways of communication. Like for example, when she said I'm worried, you could have told, I'm so sorry, Mrs. Halima, I know that you're going through a difficult situation, but as doctors we will try to do the best for your child, like this. Something everywhere, in every situation, not in one place, throughout the communication, wherever the question of mother feeling sad or bad comes, uh, you have to tell something, at least one sentence. Okay. In like this, when she asked, I missed follow up, when she was guilty. See, I cannot tell her that what she did is correct also here, right? See here,
Yes.
this is a point of dilemma. When she said that I am guilty, that she did not tell you I'm guilty, I am feeling bad that it was my fault that I did not follow the child. Yes, of course, the child is 7 years old, she did not follow, which needed a follow-up, so that if the VSD was not closing, they would have closed it, right? And she would not have landed up in this problem. There is some amount of fault in the mother, but here you cannot, when she is in this pathetic condition, you cannot tell her that. So your answer should be like, she's neither right nor wrong. Okay. So you can tell in a don't tell her that what she did is correct also. Like, so you can tell her that I know, I can understand your feelings, but we will try our level best to do the best, because now what has happened is happened, right? You cannot go back to it. But for, according to me, what mother did not follow will be, definitely it is her mistake, because she did not follow. Now the child landed up in infective endocarditis. If she would have followed with a heart doctor, maybe the operation would have been done before. Because of this VSD is staying for a long time, I don't think they will prolong till 7 years. By they will wait maybe maximum up to 5 years, and then they will operate. This is what I know. If I am wrong, if anyone is working in cardiology, please correct me. So this is prolonged because she's not following up. So in one way she is wrong, but now here in the situation, she's feeling bad. I don't want to tell her this. I don't want to go her, yes you did, oh yes you did a mistake. You don't want to tell her like this. So you can just avoid telling anything, saying that I know, I can understand your feelings, because your child is sick and she has fever from a long time. But as doctors, we always try to do the best for your child, and we will give the best possible treatment for her. Like this. Tell something else and empathize her. Okay.
Okay.
Because there are some situations which comes, definitely the role player might be wrong, but there in that moment, you cannot tell her that directly you're wrong, and it can create problems. So answer in such a way that you're not agreeing with her and you're not opposing her, both. Okay. This is the one point I wanted to tell. Otherwise, you told about antibiotics, weeks treatment, and this question was asked in the exam about the school. I think the answer was quite good. What you said, we will coordinate with the school nurse, and also you can say school teacher, both school
Mhm.
teachers, and we can tell that your child is sick, and definitely if we tell to the school teachers, they will understand and they will support you, so we can coordinate with them and do the best to the child, like this. Okay. And for the surgery, the best way you would have explained is, for the surgical part, when she said, why not do the surgery now? You told rightly that you have to, mm, the best way to tell this answer is, tell the mother that we have to first stabilize the child. Okay. We have to first stabilize the child by giving antibiotic treatment, because presently your child has fever and she is in tiredness. She cannot take this operation, and we have to give the antibiotic treatment. First treat her, bring her out of the infection, and then only we can go for the surgery, for which we will involve the heart doctor. You told all these things, but I'm just repeating, maybe with some changes. Like the best thing to tell is, your child is sick now and she has to come out of the sickness, or your child has fever and tiredness, we have to bring her out of it, for which we are giving the antibiotic treatment, and she will be monitored over a period, over weeks, till she is out of this. And at the same time, we are working as a team of doctors. You can use this word here, because definitely in infective endocarditis, just the pediatrician will not handle this case. He will involve so many people, like cardiologist, and also infection specialist will be involved here, because for the choice of the antibiotics, and cardiologist, and also dentist, as you said, dental doctor. Okay. So all this, so we will involve the team of the doctor to give the best treatment for your child, and the caries of your child will also be taken care. And the heart doctor, once your child is fine, will decide over to close this hole, so that she might not have more problems in future.
Yes, you asked me one question about that. It will recur, for which I was not sure, so I didn't answer.
It's okay. If you are not sure, you can tell the way what you said. But tell her that I am not sure. I will check and come back to you. No problem. You can tell. But usually I think the problem arises if there is prosthetic valves. If it is on the native valves, if you treat over, I mean, they will treat for you, I think 4 weeks for native valves and 6 weeks for prosthetic valves. And they will monitor with the vegetations. Once everything is fine, then only they will stop the treatment. And usually in the recurrence will be more common in prosthetic valves. And this child, as we know, she's not operated, and nothing prosthesis is put for her in the heart. So maybe less likely that she can have. But still, if you think that the question looks complicated, for one question like this, please try to give this answer only for one question. If you repeat it for multiple, they will not consider. Okay.
Yes.
Okay, I think you did well, but if because I'm doing only one scenario, really,
Yeah.
to do a meeting, it needs yourself to make up your mind, free your time, prepare yourself, everything, lots of things. So I just did only one, because long time we did not do. If in 1 minute, I'll just call. For me, I introduce with my name, and then I will confirm whether it is mother's name and the child's name is correct. Like, this is Dr. Noor, one of the children's doctor in this hospital. Am I with Mrs. Halima, the mother of Sarah? Once I confirmed with them, you can all, some people do this. How can I call you Mrs. Halima? So if you are not interested to repeatedly addressing as Mrs., you can have a choice. So if she can tell you that, how can I call you Mrs. Halima? You can call me Halima, doctor. Khalas, you're relieved that you can speak easily with her. This is one point. Or whatever she says, you have to follow her. Okay. Then if you want to avoid how are you, just tell her nice to meet you, thank you for coming here, like this, or nice to meet you, thank you for coming here to have a session, to have a talk with me, like this, something you will tell her for the rapport. Then you will start. Today I am here to talk to you about your child Sarah's condition. But before that, do you want anyone to attend this session with us? Then most of the time, if definitely there will be only one player, the answer to you will be no. No, doctor, all are busy, or only I am here, go ahead, something like this. So it will be no answer only, because you'll have only one role player in the exam. So next question, ask in general. What do you know about your child Sarah's condition so far? Then she will tell you, like, my child has a hole in the heart, or there are two options here. She can tell you my child has a hole in the heart, or she can tell you my child has VSD, because she may know the diagnosis. Okay. Because she is dealing it from 7 years. So she might tell you that my child has a hole in the heart, or VSD. If she says VSD, it's well and good, you can follow. So she will say that, well, Sarah is known to have a small hole in her heart, for which we are not following up with a doctor since long time. Now she has fever and too much tiredness since 3 weeks. See, here she did not mention you about dental caries. So when the question comes about dental caries, you can mention yourself that I read from her notes that she has 4 caries tooth, like this. You can tell yourself whatever she misses, you can add it, no problem. And whenever she says, for example, she says, I don't know what is happening with my child, doctor, I'm very worried. So you have to empathize here, saying that I am so sorry, I know that you're going through a difficult situation. I am here to talk to you about what is happening with your child's condition and give you a detailed explanation. Okay, like this. Then for me, better for the explanation of infective endocarditis to the mother, if you want to draw, you can just draw a heart. Okay, because in the explanation of diagnosis and management, always drawing is good. Okay, just draw a heart like this. But this hole is too big. You can draw a small hole, because in this it is set small. Yeah, draw a small hole here and explain to the mother that this is an infection of the lining of the heart. And what happens is, whenever there is a small hole like this, there will be a blood flow with a jet. Jet means with a force through this hole. And there is a chance that this force can damage the part of the heart. There can be some damages due to the jet of flow through this hole. And so whenever there is the bacteria reaches the heart, can cause. And since this child has 4 caries tooth, this is one of the reason. They can ask you other questions. I am just explaining you, for if they ask you a question like, why this happened to my child, doctor? If she asked, yes, she has a hole in the heart, no problem. Why this happened to my child? I know that she has a hole in the heart. Why this happened to my child? If they ask you, you have to answer like this. As you know, Halima, your child have 4 caries tooth. And from here, there is a chance that the bugs, what we call it as bacteria, can enter the blood. And from the blood, it has entered into the heart. And this hole, through this hole, there is a flow of the blood, which can cause a jet, or the forceful flow, which can damage some parts of the heart, which is the reason for the infection. Like this. If they ask you this question, you should answer in this way. Okay, and also if you want to explain the infective endocarditis with a simple drawing with the heart showing the hole, it's okay. Don't draw the vegetations and all, they will be worried. Just draw a heart with a hole and say that through this hole there is a flow of the blood which will be forceful because the hole is small, and this can damage some parts of the heart, some lining of the heart, and this is the trigger for the bacterial infection to happen there, or bug infection to happen there. If they ask why this happened to my child. Okay, so for different types of questions you should be ready. And for the school thing, it was well answered, and also for the surgery I already told you. So if anyone else has any other question, can go ahead. Any questions for this case?
Yes, actually, I have one question that Dr. Maimuna did a good job, but she said there are bacteria. In place of bacteria, we should say bugs rather than bacteria. Am I right?
Yeah, you see, always whenever you think, see, jargons, different people say in different ways. Some say that for a lady who is having a child with 7 years of VSD, definitely she will know cardiologist, right? But still, for us in the exam, better to use simple language, because even whether they know or don't know, any point of time, better to say, as I told you, there are 4 dental caries. This is the reason through which the bug has entered. Bugs, what we call it as bacteria, like you can say, that is better than just saying bacteria. Or heart doctor, we call him as cardiologist. Like this, better to explain and then give the word. Okay. And also one more thing, when you introduce for the, like, always your topic has to be introduced to the mother, right? There are 2 ways I feel you can introduce the topic. For example, our today's topic is infective endocarditis, right? So to tell the mother, why this whiteboard is not coming, that you're explaining her about infective endocarditis, you can tell her in the two ways, like starting just giving the term and then explaining. First give the term like infective endocarditis, then explain her, or explaining and then giving the term. It is your choice. Okay, but I feel better to explain and then give the term, so that when we give a new term to them, they get astonished. I haven't heard any time this, what term is it, right? So better to explain and give the term. This is this is what I feel, but different people have different opinions. For example, I will tell you in this case. So after asking her for attendance and previous knowledge, now she told you that I'm worried what's happening with my child, 3 weeks she's suffering. So you will tell that I am here today to tell you about your child's condition, what's happening with her, and you will start explaining. So you will tell her that your child is now having your child is now having a condition called infective endocarditis. Have you heard about it? This, for me, if you tell before explaining, I feel that they will feel too much worried, and too much worrying question they might bombard on you. Infective endocarditis, what is this, doctor? I have never heard in my life, and it sounds to be scary. Like this, they can tell you. If you say that today I am here to explain to you about your child's condition, your child is suffering from a problem called infective endocarditis, have you heard about it? They might bombard you, because the new word, some strange word you are introducing. And then you will explain to her, she'll bombard you, then you have to calm her, then explaining, I feel it becomes a difficult. The other way around is easy. Like tell her that So today I'm here to explain to you what's happening with your child presently. See, this is the heart, and as you know that your child has a hole in the heart. She knows this already. So what has happened is there is a blood flow through this hole, and which is forceful. Because of this force, there can be some, don't say major, there can be some damages in the linings of the heart, Now what happened, and also you know that your child has caries tooth. From this tooth, there is some entry of bug into the blood, bugs, what we call it as bacteria, into the blood, and these bacteria will get lodged into the heart, and they cause the infection of the lining of the heart, which we call it as infective endocarditis. How many of you tell me that explaining which way is good, first way or the second way?
I think second way is good.
For me, I feel second way is the good, but I want to know from most of you. For to explain the first way, do you want to give any more ideas? Others, most welcome. Because for me, you introduce some new word and then explain, maybe they might get astonished, they might fall on you, or they might tell you you have to calm them, and it might take time. Explaining what it is and then giving the term, I feel it's better. But if anyone has comments on it, please go ahead. So I personally tell that please use drawings. Drawings will make life better, and also it will give you marks that you followed many steps of the examiner will know that you made an effort to draw. Whenever there is explanation, don't explain blankly. Don't explain. Yeah, I agree with you. Infection of the lining of the heart. It was very beautifully said. But if you tell it with a drawing, I think it will add more to you. How many of you agree with it? We have 62 participants here.
I agree to it.
For the two things I'm asking. One is drawing and the second way of explanation.
Yeah, both. Explaining the term before you tell them about the cardiology.
That is what this is my feeling. I tell them some word which is strange and then explain. No, it's difficult for them to take in. Explain and then tell the term. It's okay. Term, whatever it is, they will accept with you.
Yeah, maybe they will not be able to understand your explanation later. So it's better to tell them first the explanation, and then you tell. In our language, we say the heart doctor as a cardiologist, or like this.
Yeah, heart doctor, cardiologist.
Yeah.
You can also say simple words. They will not consider. They want more simple language. Tooth doctor, dentist. The doctor specialized in infection. If you don't know the words, you can say like this. A doctor's you don't want to say infection specialist, or so you'll just say a doctor specialized in infection. Okay, like this. To use this word, and for the starting few sentences, I told you, for all the communication scenarios, the starting few sentences will be same. You should practice it. Your name, your introduction, and your rapport to the child or to the mother, how you will build. Okay. So anyone else wants to do the same scenario? If you want, you can go ahead for practice. So I hope the questions about this scenario, how the questions will come in the scenario, it's clear, and how you will explain the scenario is clear. The question format may be different in the exam. So just know how the questions will come and how will you answer the questions. Is it clear for all, or you have any doubts? No doubts, mashallah, we are up to the mark. Okay, so if no doubts, we can go to the second part of our topic today. So, Dr. Maimuna, you're here still?
Yes.
Yeah, today you got to know, right? Like if you get a topic suddenly, how to
Yes.
handle the case. Okay. So
So
for
if
the
a little idea, then we can do. But if a topic never read, so it will be difficult.
yeah, it will be difficult, but still you should be able to handle. This is what I am telling you. For example, in Jeddah, I don't think in KSA tuberculosis is very common, but it came and candidates did the communication and they passed. Okay, but if you have basic knowledge of tuberculosis, you can pass. That is what I want to convey you the message. You got my point. You have basic knowledge of see, you don't want to give like 4 weeks native valve endocarditis, 6 weeks prosthetic. This is not required here. You are in doubt 3 weeks, 4 weeks, you are in doubt. You told few weeks, accepted. You got
right. Yeah.
No need here 4 weeks. I told 4 weeks because I read it today. 4 weeks, that's why. From the new this patient info, I read it. So I am telling you 4 weeks for sure. But I have not read. Suddenly I can say few weeks, maybe 3 weeks, maybe 4 weeks. You can also tell, as you said, the heart doctor will also see the child and decide over how many weeks and how long he wants to take, and it will also be monitored by the jelly scan of the heart. Okay, so one thing we missed, it is for all I'm telling you, when you are telling to the mother, you should also tell that we diagnosed it through the jelly scan of the heart, which showed some changes in the heart, which is going with the infection of the lining of the heart. Okay, you can tell all these points and then give the term to the mother. Okay, always this is my feeling, but you can follow your own. There's no hard and fast rules. Everyone has their own way of presentation and own way of approach. Okay, this we forgot when we are explaining. Also, because in the scenario it is written that echo was done. This you should convey the message to the mother that a jelly scan of the heart was done. Don't say vegetations and all, no need for the mother. Just say jelly scan of the heart was done, and it showed some changes in the lining of the heart, which is going with the infection of the lining of the heart, which we call it as infective endocarditis. Like this. And also, if she asks you why this happened to my child, you should be able to give the reason how the bacteria went to the heart, which is not common in all children. It is especially for the children who have heart diseases, and how the lining of the heart got damaged, what is the cause for its damage. Everything has to be explained in the simple language. And today our aim was, even if you don't know what is the topic, you should be able to handle the communication. Only maybe even in the exam, they will prepare the questions in such a way that only one question will be such that you can say that, I don't know, I will go check about it and come back. Okay. Well, as far as what I know is, for the native valve, means the child who is not operated and there's no prosthesis, usually it will cure. But if there is prosthesis, there is a chance of reinfection. But if anyone knows more or correct, please correct me if I am wrong. Okay, or check back and message in our group, no problem. Okay, any comments before we finish about infective endocarditis? All of you should always know about infective endocarditis, about in whom you will not give prophylaxis and in whom you will give prophylaxis. This question will be asked in the exam. Suppose if your maybe a clinical case came to you in cardiovascular system, showing for you clear like splinter hemorrhages, Janeway's lesions, and features of endocarditis, I mean, and also there is a new murmur in the heart or something like this question will be asked for you, like when the child do not require antibiotic prophylaxis, and when to consider antibiotic prophylaxis. All of you should know this. Okay, I will not read it now. I am just telling you, read this from pediatric guidelines, green book, and keep it. For example, when to consider antibiotic prophylaxis, consider antibiotic prophylaxis for following children in consultation with cardiologist. That is, with any prosthetic valve, including transcatheter valve, or those in whom any prosthetic material was used for cardiac valve repair. Not just prosthetic valve, any prosthetic material used also you should do in this antibiotic prophylaxis. Okay, and also if there is previous episode of infective endocarditis, like for our patient, we should consider antibiotic prophylaxis. If they would have asked you, if she becomes one time she had infective endocarditis, right? So she needs antibiotic prophylaxis in future. And with following congenital heart diseases like cyanotic congenital heart disease, any type of congenital heart disease replaced with prosthetic material, whether placed surgically or by percutaneous techniques up to 6 months after procedure, or lifelong if residual shunt or valvular regurgitation remains. So if you have done a CHD repaired with a prosthetic material 6 months after the procedure, but if there is any residual shunt, murmur, or regurgitation, you will take it lifelong. So all these points you should know. This question will be asked when you do not require and when you require. Okay, this because infective endocarditis can come as an history station as well. It can come in the cardiac clinical station, and it can come as communication, which we did today. And one more thing, the source from where you'll read about infective endocarditis is this patient info. I feel it is better, but it is vast. It is too much. Okay. Where is this patient?